Appendicitis. This is a disease that most people know about because it's common enough. In fact, it is the most common cause of acute abdomen in the world. So it is also the killer of Harry Houdini. It is the one magic trick he could not do was to escape from appendicitis. Usually it presents with right lower quadrant pain, and that's a pretty good description. I mean, a lot of these different diseases that we talk about, there's the classic symptoms, and then there's the symptoms that really happen. But with appendicitis, right lower quadrant pain is a real common presentation, as well as anorexia. These people don't want to eat, and nausea, which probably is the cause of their anorexia. And there are other things that you want to rule out. Mesenteric lymphadenitis, I've included a little bit more on here because I'm not going to talk about it anywhere else. But it's just a swelling of lymph nodes in the mesentery around the intestines, and it often is right-sided because a lot of those lymph nodes are on the right side, and so it presents almost identically. In fact, around 16% of children presenting with probable appendicitis end up having mesenteric lymphadenitis. So this is a good thing to have a high index of suspicion for. It's caused by infection in most cases, usually viral. It can also be a result of inflammatory bowel disease, group A strep pharyngitis, and lymphoma. Other conditions that need to be ruled out are gynecological conditions, especially PID and ectopic pregnancy need to be ruled out, which you usually can do fairly easily with an ultrasound and a pregnancy test, a beta HCG test. And STDs and diverticulitis are also things that need to be ruled out. On the exam, Murphy's sign is the common sign associated with appendicitis. You're just going to push on the lower right quadrant, and a lot of these people will have a lot of pain there or tenderness there. And rebound tenderness means that you push in slow, and the pain comes when you release, which is a good indication of peritonitis. Roseving sign is actually when you push on the other side of the abdomen, it hurts on the right side. So another sign is obturator sign and psoas sign. Those are both tests that you can do to see if you can elicit pain, and those are good indications that you have appendicitis. They also can have some diagnostic value in determining where the appendix is sitting. Palpation, rectal exam, Guaiac card for occult blood, and a gynecological exam are all important in examining these patients. Then you send off the labs. These are just some made-up numbers here. But the most important thing to look at on the CBC is the white blood cells. They're going to be elevated in acute appendicitis. There is a possibility of bleeding, which you might end up with an anemic patient. So you look at your H&H levels as well. Electrolytes, ALK, phos, AST, ALT can help us rule out other things on our differential diagnosis list. For example, liver problems, gallbladder issues, things like that. Urinalysis and beta HCG we talked about for ruling out possible other conditions. Then we do a CT scan. You can look at these with an ultrasound as well, but CT scan is going to be the most sensitive test for appendicitis. And what you're looking for is the cecum, and the appendix is going to be sticking off the cecum in some direction. So appendicitis, generally you treat it with surgery. There are instances where you will watchfully wait if there's a high risk for surgery and the symptoms are not severe. You may hold off on surgery, but most of these people need to go to surgery so we can prevent rupture and the infection that comes after that. So you can do an open appendectomy. You can also do laparoscopic appendectomy. So with the laparoscopic, most people are going to put in a trocar just below the navel, and what some would say would be the most aesthetic way, or aesthetically pleasing way to put the trocars in would be right here along the line of the inguinal ligament. And the bowel is followed to the cecum, appendix is identified. You dissect out the base of the appendix first so we can help to prevent perforation. The appendix is stapled and then transected, and the appendix is placed in a bag and pulled out. After the surgery, we want to make sure you are watching for abscess, bleeding, and infection, pretty typical of bowel surgeries. You want to make sure, of course, that you watch out for DVT and respiratory complications that also are typical of all surgeries.